Hi Ruth here, welcome to my channel Health for Freedom. Today we're going to talk about the hidden corners of the brain, and to talk about that theme I have a special person with me today, Emma Tussig, a clinical psychologist that works in the area of Gothenburg, Sweden. Welcome Emma.
Thank you, it's great to be here.
It's really great to have you here today, and I'm really glad that I've met you and that we can start thinking about our work together, because your passion for people is really something that has really struck me.
Thank you, that's very nice to hear.
Do you want to talk about yourself, what you do a bit before we go on to the questions?
Absolutely. So as you mentioned, I'm a clinical psychologist. I work here in Gothenburg with my husband, Johannes, who's also a psychologist. So we have this private practice together since a few years back. And before that, I was in psychiatric settings, working mostly with people with psychosis and things like that.
Emma, about today's theme, it's something that I really find interesting. You know, the hidden corners of the brain. Is there something more to our feelings that we're not really aware of? And as you know, I work a lot with people with depression, people with burnouts, and I usually go in deep. I like to take the patient as a whole. So I like to look at the patient to try and understand if there's any factors I must understand. I like to look at the circumstances the patient lives in, both professional and private. And I even like to look back at the person's lifeline to try and understand some symptoms. But there are patients that one can really not find the cause, and the patient himself or herself cannot really find the cause for the symptoms. Is it so that the brain can be hiding something, or how does the brain work?
I mean, mostly we're not really aware of everything that's going on. So the brain is excellent at filtering information, which means that maybe it's not hiding things per se, but mostly it's choosing to make us aware of the things that we should be aware of, to be able to function, to have a good life, to be efficient. If we were to be aware of everything all the time, we wouldn't be able to work or even, you know, keep our focus on taking care of children or anything like that. So yes, I think when that happens, that we find that something is going on and we're not sure what it is, I think mostly it's because it doesn't fit in our narrative. So you can think of it that way, that we have this one part of the brain will be more about, you know, taking in information, using our senses to you know, to know what's going on outside us. And then we have this other part of the brain, the left side of the brain, that makes stories about it, that makes everything coherent. Okay. So when you think about an infant, for example, who doesn't have any language, who doesn't have any sense of, you know, who they are or what people are like in general, they only have this unfiltered sensory information, and they're like wide-eyed and, you know, totally open, but they're not very efficient, maybe. So as we grow up and our left brain evolves and comes more online with language, we get these stories that help us make sense of the world. And sometimes things happen that don't fit, that we can't integrate really. For example, if you have a caregiver that is sometimes abusive or that can't be trusted, maybe a parent that drinks a lot or something, sometimes they're strange and weird, and the child still is dependent on this person to care for it. So, you know, it wouldn't be wise for this child to fully understand what is going on, to fully, you know, take in the fact that my caregiver is not maybe a nice person, because they're still in that dependence.
So it can actually be a protection.
Yes, exactly.
Okay.
And then sometimes that will last and will take a long while before we sort of understand that maybe things happen that, you know, weren't supposed to happen, or maybe things that were supposed to happen didn't happen.
But if it's a protection, Emma, how do you think, in the case, like you said, in the case that there is an abusive parent, for example, and is it important that the child, because in some instances, then what happens is another person or another parent takes charge and wants to protect the child. And sometimes one doesn't know, okay, is it better to take the child to see someone to get help? Or is it better that the child carries on not knowing or forgets about everything that has happened? What is actually better?
I mean, I think that's an excellent question, because I think as parents we have this temptation to sometimes protect our children by putting on a brave face and saying that everything is fine. So, for example, when a child will fall and start crying, a lot of the time parents will be like, oh, that's fine, nothing happened, you know, we're reassuring and we're helping the child to understand that it's normal, and then they can move on. And I can understand the temptation to do the same. But the difference is that when a child is subject to abuse, and when an adult that is supposed to take care of the child actually is hurting it, that's something that shouldn't happen. That's something that's potentially traumatizing. And when we neglect to show the child that this is unacceptable behavior, this shouldn't happen to you, yeah, we can let them live in that lie for a while, but eventually this child will grow up, and eventually these things, as we talked about before, the body remembers these things, and we will get reminded in one way or another later on. And when a child grows up and understands that, yeah, okay, I had one parent that abused me, and that was maybe, you know, drunk or something, and my other parent let it happen and pretended that it was all fine, that's a double deception, really. So that's that will add extra trauma later on. So I think that's important to remember. And then, that said, it doesn't necessarily mean that you know, we always have to take the child to therapy. That's not always the best option either. But to, you know, to be clear about what is reasonable to accept and what is acceptable behavior and what's not acceptable, and provide safety and, you know, offer to answer any question the child has, I think is something that we need to do as adults.
Right. Yeah. And I can think that sometimes we so worried about taking a child to therapy, which I think it's really important when needed, of course, but sometimes we as parents, we ourselves should seek therapy to find instruments to help the child.
Yeah, definitely.
And say I would have something in my life that I wasn't that wasn't really clarified. So I have some symptoms that I don't really understand. What kind of symptoms should I be looking for that might show that there is something in my life that I should try and understand a little bit better?
You know, mostly we get on with life, right? So we have things to do, we have work to do, we have things that need to happen, we need to take care of our household and everything. And it's when we feel that something is wrong that we should pay attention. And that feeling can come in so many different ways. But I think for most of us, we all have a sense of like that there is this place inside, there is this quiet voice sometimes that will tell us what we need to do, where we need to pay attention. But it can be, you know, a range of different symptoms. I think most of the time when there's trauma and when there's, as we said before, when there's like blocked memories or a story that doesn't fit, we usually will react with anxious feelings or depressed mood states. Those are the two most common things. But they can, you know, we can have anxiety and depression for lots of different reasons. But I think mostly if we start feeling things that we feel like this isn't really me, this isn't, something's up, something's wrong, I think it's always good to take that seriously and to try and find some help to explore it, even though, even if we don't have a clear question. I see a lot of clients that come and they don't really know what they need, or they don't really know what's wrong, and you don't have to know what's wrong to be in therapy. That can be what therapy can be for as well.
Oh, that's right.
Yeah.
I usually see many youngsters also. So it's not only burnout I work with, but depressions, and it's just so painful to see youngsters that have different kinds of symptoms, and even hallucinations, for example, and they've got no diagnosis because there's no diagnosis of a psychosis. Is it possible to have hallucinations, for example, where there is no psychosis, and it can be rather because of those hidden things in one's life?
That is absolutely possible. I mean, it all depends on the level of stress, I think. We can all get psychotic symptoms when we're in stressful situations, even if we have no psychotic disorder like schizophrenia. I think if you find yourself really worried about, am I going crazy? I think it is important to seek out medical help and to get help in understanding and exploring those symptoms. And often that will include some kind of assessment of whether it is some psychosis that's starting to evolve. But I think most of the time it isn't. I think most of the time we can have all sorts of experiences, like feeling like my body doesn't belong to me, or even not recognizing myself in the mirror, or feeling like everything is surreal, or even having voices. There were actually some studies made that pointed to the fact that it's more common to have voices in cases of dissociation caused by trauma than in schizophrenia. I think that's really interesting.
Emma, can you clarify that about dissociation? What is dissociation really?
So dissociation basically is the opposite of association, which is linking things together. So dissociation means splitting things off from each other. And it is a mechanism that we use spontaneously and automatically in our bodies and brains to be able to keep functioning, even though things might be going on that we can't really cope with. So dissociation is a phenomenon that everybody uses every day in some way. So in a mild form, it can be, for example, when you're driving and suddenly you reached your destination, but you have no idea about the journey there. You haven't been aware of all the roads you took. It means you were somewhere else in your mind. You were dissociated from the present moment. And when we talk about trauma and trauma-related dissociation, I think we talk about this fact that we dissociate some part of our stories, our life stories, to be able to keep living like before. So I'm thinking about people that, for example, live in relationships where they are sometimes abused. I'm thinking about, for example, it's not uncommon that sometimes even in a relationship there will be sexual abuse. Sometimes person can even be raped by their partner. It's not, it happens. And a lot of the time, actually, the victim of the rape will be mostly unaware of this in the daily life. It becomes something that doesn't really fit the story of being a strong and independent person, or being in a solid relationship and things like that. So dissociation will allow this person to just keep on living. So it's an adaptive function, really.
And this dissociation, can we say that it is the blocking of the brain, in other words?
Exactly.
Is there any age up to which this dissociation mechanism is easier or happens most?
I guess you can say that in order to be fully aware of what is going on, you also need to have the resources and, you know, the ability to cope with everything. This means also having a sense of self and a language. So it's kind of hard to answer really, because I think in one way dissociation is you sort of need to be able to have a story to be able to dissociate, if you know what I mean. Because a child's brain isn't really, you know, it's not really finished yet. So children live in a sort of more timeless experience where things just happen and it's more chaotic. And it's mostly later when we grow up and we start building sort of really who we are and understanding who we are and who other people are to us, that we become more rigid in what we experience as true and false. So yes, I think children have the ability to sink inwards, to go inside themselves, and, you know, they have this imagination and everything. But I think dissociation is maybe more of a, you know, as a protection. We maybe use it more when we're older. But mostly, I think, when we start to realize something might have happened to me that I can't remember, or I have these symptoms, it's like something's going on. That thing usually happens when we feel safe enough for things to resurface. So for example, when we see refugees fleeing from war zones, for example, and they come to a new country, it's common to have the big breakdown or the big crash or the big reaction to what really happened once you get your permit of residence, because then you know you're safe, you have space for it then, and you have to sort of block it out as long as you're still under threat. So I would say it's more about safety and resources than age.
Maybe that's why that some people get their symptoms when the brain is more mature.
Yes.
Okay.
So a lot of people will say, you know, I don't understand why this is going on now, because this happened so long ago. So why do I feel like this now when everything should be great? That's a common thing. I guess you hear that as well.
Right. Yeah, I hear it. Yeah, I hear it a lot. So what kind of therapies would you recommend?
Well, it all depends on the person. If we're talking about trauma, there are different ideas of what can help. There are different evidence-based treatments like CBT for trauma, prolonged exposure. And in those therapies, it's about going back to the trauma memories, revisiting them, and in that way you try to relieve the shame and the terror and all the emotions attached to it. So it's about integrating the traumatic memories, making it a part of the story. Right. So that's one thing. In my work, I usually work with the now. So I start where the person is now, and we look at the symptoms, and we look at what is trying to be expressed. So most of the time when you have anxiety, it's because there is some conflict. There is one part of the person that is trying to be heard, that is trying to signal distress and pain and discomfort. It's the part of the person that is carrying the memory, really. And then there is this other part, the functional part, that is trying to hold this pain away and to block it. And because there is conflict, it's like the temperature rises in the system and it becomes anxiety. And so what I do, I usually try and use this imagery of parts. In my work, sometimes I work with clinical hypnosis. That's something I think is really helpful for this. It's sort of this playful, creative way of working with yourself and exploring your inner world. And in hypnosis words, we talk about ego states. So it's different parts of the personality, and we use imagery and help the person integrate the different parts, so right. that you can feel more whole and you know, feel like you're all the parts of the system are working together in the same direction.
Hypnosis is something that many people are scared of.
Yeah,
They're scared of not being in control. Is that something one should be scared of?
Absolutely not. I mean, in clinical settings, when we talk about clinical hypnosis, we always stress this fact that you are always in control. It's not me hypnotizing you. It's me providing instructions and you choose what to do with them. So you can, I always include this in my instructions, that you can choose to just change my words, or you can choose to follow the instructions or just let them pass by and do whatever feels good for you. And a lot of people think about hypnosis as some sort of different state where you're not yourself. But I think it's not really that. It's using this process of dissociation that we all have, and we're using it to increase the focus on something. It's not about decreasing the focus on other things. It's about increasing the awareness and the focus in our inner world. So we're working in that area, you know, when you're about to fall asleep and you're like half awake, halfway into a dream, and things are happening and you sort of, you know, it's not really real, but you're still engaged. That's where we work in hypnosis.
Okay.
So it's really gentle, and mostly people enjoy it, and you come out and you feel like you've been getting some good rest.
But can you trust the memories that come with hypnosis?
The memories are always subjective. Every time you bring out a memory, even though you feel like this is my memory, I know it was exactly like this, it's probably not correct, because every time you bring it up to the surface, you change it a little bit. It gets a little tweaked, and you know, it gets influenced by what emotional state you have when you think about it again. So memories are memories. They're not facts. It's a subjective experience, but that's okay. It doesn't matter, because your subjective experience is where you live. So that is the thing that needs to function for you to be able to, you know, live a good life.
Just before we finish, and we talked about aggressive behavior. Can an aggressor forget?
Absolutely, I think so. Being an aggressor is not something that you are totally and completely. It's being an aggressor just means being someone that did something that hurt somebody else, you know? So I think all of us have different parts, and sometimes we do things on an impulse, sometimes we feel enraged and we act on that feeling, but most of the time all of us, I think, want to be good people, and we want to be loved, and you know, we want to contribute. That's my thought. And following the logic, like before, like when you do something, when you experience something that doesn't fit your narrative, that will probably be outside your awareness.
Right.
It doesn't make it, you know, it doesn't make it less wrong, but yeah, I think that happens.
I can just imagine how much dissociation one that has to go to war, for example, and harm others, and go against, you know, everything one believes in. Emma, thank you so very much for being with us today. It's been a pleasure, and it's so important that we all try to find any hidden corners in our life. Would you like to say anything to to the people that are listening to us as a recommendation?
Well, firstly, I want to thank you, Ruth, for having me. It's been really interesting and good to have this discussion. I think, what I want to convey is to trust in our body's way to show us when we need to pay attention. So there's always that tiny inner voice that knows, right?
Right.
That still voice inside that knows what we need to do, and nothing bad can happen from wanting to explore and being curious about that.
Great, thank you so much. And just before we finish, I can't stress enough the importance of seeking the right people when we talk about therapies. So when we need to try and find out the hidden things in our life, when we need to treat those things and to be free, it's really, really important we seek the right people. And what I mean with the right people is, I mean people in the medical field, people in the psychology field, people that understand what the details of the brain are and how the brain functions. Thank you for watching. We'll see you next time.